Hello again. I'm Dr. Nunez with Living Health. I have chronic kidney disease. What can I do? That's another question that I get a lot of too. Kidney disease is very, very common. And in fact, 10% of deaths annually come from some form of kidney disease. And kidney disease is a whole spectrum from very mild to very severe, where you end up on dialysis and the like. So what can you do? Are there things you can do? And the answer is yes. And this series of talks is about lifestyle medicine. These are lifestyle factors, things you do on a daily basis, the choices you make in how you live your life that can impact your health and well-being. It's an area of medicine called lifestyle medicine. These are things that can help prevent some of these diseases and can help manage them if you have them, and in some cases even reverse them. So if you like these kinds of talks, press that thumbs up, press the subscribe button, and press the little bell so you can be notified of future videos. And leave a comment. And if there are enough comments about a particular subject, we could do a talk about that as well. So chronic kidney disease. How does this happen? What do we do about it? What can we do about it as an individual? Always, obviously, you consult your doctor, consult your kidney specialist, your nephrologist, and the like. Kidney disease has become remarkably prevalent. If you have very mild chronic kidney disease, it doesn't always progress. So it's not like you're always going to be moving forward along the spectrum and ending up with end-stage renal disease, which puts you on dialysis or on a list for kidney transplantation. But what can you do to look at that? Well, if you have high blood pressure, definitely manage your blood pressure. And we've spoken about blood pressure in other talks. So either you can manage it with medication, manage it with diet, the DASH diet that we mentioned before. That's low in sodium and low in meats. There's also the plant-based or plant predominant program, and I'm going to list below some links that you could look at to go into more detail on some of these diets. I have talks on the DASH diet. I have several talks on plant predominant eating and the like. What you want to try to do is avoid heavy loads of protein. So yes, the animal meats and the like are very high in protein, and your kidney has to process some of this and excrete it as it processes protein through your metabolism. So be careful with that, and always hydrate well, especially if you've loaded up on protein in some kind of a meal. Yes, if you avoid the red meats and you avoid eating a lot of meat and reduce your meat intake, that's going to be a big advantage to you. As you move more towards the plants, that will be an advantage. Many of the meats have phosphorus, or also phosphorus is found in other foods that are salty or in sodas and the like. And phosphorus is one of those things that can impact your kidney health. So if you're hydrating well and you're limiting your meat intake, that can be of great help. And if you manage your blood pressure, sometimes you can manage that with the diet. That can be of great help too. You can also add exercise in. Now, it's important that when you do exercise, that you always maintain good hydration. Remember, kidney is always going to want you to be well hydrated. Drink lots of water. If you're thirsty, you're already behind on your water intake. If your urine starts to get darker, it should be straw-colored, light-colored urine. As your urine becomes a darker yellow, you're probably already behind on your water intake. So hydrate well, especially if it's hot out or if it's humid out and you're doing something that's particularly sweaty. So hydration, low protein loads, switch over to the plants as much as you can, plants, whole grains, those sorts of things. And also try to be in contact, socially connected with your loved ones, with your friends, so that you're stressing less. And that can also help de-stress your kidneys, believe it or not. So think about reaching out to people and trying to live a life that's a little bit lower in the stressors that there might be. Now, in the world of nutrition, in the plant-based world, it doesn't mean that you have to be vegan or vegetarian. So don't be put off by that. If you are eating meat 5 days a week, try just reducing, one serving of meat for the week, and include an extra serving of fruits or vegetables. And that might be a way that you, in a stepwise manner, start to limit your exposure to the red meat world in particular, and the animal products as a whole. And as you switch more to those plant-based meals, then you'll probably start to feel a little lighter as well. So do that gradually, one step at a time, and you can get there. So remember, this is all about lifestyle medicine. These are things that you can do, actions that you can take on a daily basis to improve your health and well-being. And yes, there's a lot that can be done in the kidney world to address chronic kidney disease, to try to prevent you from advancing all the way out into end-stage renal disease and putting that off so it doesn't happen to you. And if you have started to have some chronic kidney disease, these are actions that you can take to help improve kidney function, or at least not have that advance. If you like these kinds of talks, press that thumbs up, press the subscribe button, and press the little bell for future notifications. If there are other things you'd like to discuss, you could also put something in the comments, and we can look at that as well. So until next time, I'm Dr. Nunez with Living Health, and check out the links below too. Bye-bye.